Welcome to Coconut Cove, a skilled nursing facility to exceed your expectations. Presented by Katie Choinka, Grace Dickey, Tiffany Martin, Kelly Preston, and Katie Roush. Coconut Cove Senior Living is a skilled nursing facility that provides excellent around-the-clock care for the geriatric population. This facility will include rehabilitation and healthcare services. Services that will be included are physical therapy, occupational therapy, speech therapy, recreational therapy, nursing care, and on-call medical services. Coconut Cove is located in St. Petersburg, Florida. The mission of Coconut Cove's skilled nursing facility is to provide superior care specializing in the geriatric population to improve the quality of life of each individual under our care. To accomplish our mission statement of providing optimal care, we will take the following steps. We will provide skilled therapy services to achieve maximum independence and function. Professional counseling services will be readily available for residents and family members to provide emotional and financial support. We will ensure the residents experience a safe and comfortable environment to build trust with the healthcare team. Each resident will be treated with the same level of dignity and respect, regardless of the level of functioning or disability of the individual. The healthcare team will strive to perform personalized evidence-based treatment to meet individuals' needs. It is our vision to optimally serve the geriatric population by enhancing their physical, emotional, social, and spiritual well-being in a compassionate and healing environment. By accomplishing our mission and proving proficient care, we will strive to be the skilled nursing facility of choice in the region. Coconut Cove Skilled Nursing Facility is committed to having an organized approach in delivering high-quality care. The rehabilitation team is led by a licensed therapist that oversees the entire therapy department. The therapy department includes physical therapy, occupational therapy, and speech therapy. This flowchart demonstrates the hierarchy of the organizational structure.
All therapists at Coconut Cove must abide by the Florida State Practice Act. The rehab director is required to be a licensed therapist that oversees the entire rehab team. The responsibilities of this individual will include aspects from administration and providing health care. They must be aware of changes in any practice laws and ensure that they are implemented within Coconut Cove. He or she will also have administrative duties. These include developing and implementing policies and procedures pertaining to staffing and the budget of the department. The rehab director may give input into developing the budget. They are capable of resolving escalated issues arising from operations and requiring coordination with other departments. The rehab director will also lead team meetings, perform scheduling, and payroll. The director must also be capable of providing care to residents of Coconut Cove when needed. As a physical therapist at Coconut Cove, the ultimate responsibility is to treat residents with professionalism and respect. Therapists will use clinical judgment to administer therapeutic exercise, modalities, and manual therapy as needed. Therapists are responsible for the patient's well-being during the time that they are being treated and should monitor the patient for the duration of the therapy session. Therapists are required to use skilled clinical judgment to know when to notify the doctor or other healthcare professional regarding the patient's status. Therapists must document detailed notes every time the patient has been seen. The physical therapy assistant, or PTA, must be under the supervision of a physical therapist. It is their responsibility to communicate with each therapist regarding the treatment and status of their respective patient. The PTA, like the PT, must administer therapeutic exercise, modalities, and manual therapy under the plan of care decided by the PT. PTAs must always treat patients with professionalism and respect and communicate with other healthcare professionals to keep up to date with their patient status. PTAs must document detailed notes, including everything performed during the therapy session each day the patient is seen. The rehab aide must work under the supervision of all therapists. He or she must treat all patients professionally and with respect to ensure quality of care. He or she will perform jobs such as cleaning the therapy gym, escorting patients to and from therapy, communicating with healthcare professionals, patients, and families, and assisting with patient care under the supervision of the physical therapist. Salaries for physical therapists are a big part of the decision-making process of professionals looking for jobs. As a new business, we must find a wage that is fair but will also be appealing to future employees. Some factors that can affect the salary are the position being part-time or full-time, the location of the site, and the type of physical therapy clinic. Something else that will determine not only the salary but the reliability of the employment is the projected employment rate. In 2016, the number of physical therapist jobs in the U.S. was 239,800. From 2016 to 2026, the employment of physical therapists is projected to grow 25%, which is much higher than the average. This means that 60,000 more PT jobs will be available within the next 10 years. With this in mind, it is a great time to open a new facility to help benefit the lives of more patients. The national average salary for physical therapists is $85,400, and the Florida state average ranges between $84,210 and $87,750. At Coconut Cove, there will be 3 PTs on staff and will make a salaried wage. Their salary at Coconut Cove will be $87,000 a year. We decided with this wage because it is the higher end of the state average due to this site being a skilled nursing facility. The national average salary for a physical therapy assistant is $56,610, and the Florida state average is $62,730. At Coconut Cove, there will be 3 PTAs on staff, also on a salaried wage, and their salary will be $63,000 a year. We decided on this wage for the same reason as physical therapists. Since the location is in Florida and at a skilled nursing facility, the salary was set slightly higher than the state average. Rehab aides will be paid hourly instead of salaried like PTs and PTAs. The national average wage for rehab aides is $12.35 per hour, and the Florida state average is $12.47 per hour. At Coconut Cove, our wage is $14.50 an hour. We decided on this wage because of the site being a skilled nursing facility and the increased skilled job requirements compared to aides in an outpatient facility. PRN therapists will be provided as needed to work on weekends or if understaffed due to illness or emergencies. The national average for PRN physical therapists is $74,178, which calculates to around $45 per hour. At Coconut Cove, we will have 2 therapists that will work PRN, and they will make $60 per hour. This wage has been determined due to the fact that PRN therapists generally make more money than full-time therapists and will not receive benefits.
Here at Coconut Cove, the facility will represent a relaxed, vacation-like environment that caters to the residents' individual needs. One of the main goals of advertising this facility is to ensure that potential residents at Coconut Cove will find a comfortable place to call home. The administration of Coconut Cove is responsible for managing funds and staff members allocated for marketing purposes. Staff members will reach out to local referral sources and provide transparent information about Coconut Cove. Additionally, marketing will be used to recruit staff members to work for this facility, especially nursing personnel. Employee recruiters will visit local healthcare schools and college career fairs to provide potential future employees with the information as well as spark interest in the individuals to become employed by Coconut Cove. The tools that will be used in this marketing strategy include television commercials, billboards and posters, pamphlets, and communication with potential referral sources. A multidisciplinary team will provide care for the residents at Coconut Cove in order to provide top quality of care. This team will consist of a leading physician, nurse, physical therapist, occupational therapist, speech therapist, psychologist, dietitian, and a social worker or case manager. The team will meet once a week to discuss the different resident cases and their specific needs. They will discuss discharge planning and what will need to occur in order to assure a safe return to home. The patients at Coconut Cove will receive excellent care within their therapy. For each physical therapy session, the resident will be paired one-on-one with a therapist that can provide direct and meaningful treatment. The length of therapy sessions will be determined by the insurance provided by each resident. but will typically last from 45 to 90 minutes depending on the amount of care needed. Patients will also be able to participate in group therapy sessions if appropriate. The type of insurance that the majority of our patients are predicted to have is Medicare, based on the type of facility and the type of patients our care is geared towards. However, if a patient either doesn't have Medicare or is not eligible for Medicare, Coconut Cove will accept all private health insurances as well as out-of-pocket payments. Payments via Medicaid will not be accepted.
The Rehabilitation Center at Coconut Cove will be open Monday through Friday from 7 a.m. until 4 p.m. Every staff member will be allotted a 1-hour lunch break. On weekends, we will be partially staffed with primarily PRN employees. This facility recognizes all major government and religious holidays. Employees who work on these holidays will be given time and a half. In accordance with national and Florida state legislation, all therapists, including but not limited to physical therapists, occupational therapists, speech therapists, and recreational therapists, are required to maintain a valid license and board certification within the state of Florida. In the event that a staff member is unable to renew or maintain a valid license, this matter will be discussed on an individual basis with the respective staff member, supervisor, and human resources. It is highly recommended but not mandatory for all employees to participate in a professional organization such as the APTA to stay up to date on current literature and legislative changes. All employees in the rehabilitation office are required to be certified in CPR, basic life-saving services, and first aid. Upon hiring at Coconut Cove, every new employee will be given a copy of the facility's policies and procedures with an acknowledgement page that is to be signed by every new employee. It is the personal responsibility of each employee to maintain a copy of this manual for their own records. In the policies and procedures, the following topics will be covered extensively: family medical leave policy, equal employment and non-discrimination policy, workers' compensation, sick days, paid time off, employee behavior expectations, pay and promotions, benefits, social media policy, privacy policy, sexual harassment, ADA compliance, Fair Housing Act, and typical fire and safety regulations. The aforementioned policies and procedures are subject to change at any time. All employees will be notified in a timely manner of policy changes and how they will affect our facility. One of the primary features of Coconut Cove's skilled nursing facility is our state-of-the-art therapy gym. The floor plan seen here is how we have chosen to lay out our rehabilitation gym. In our state-of-the-art gym, the following equipment can be found: cold packs, hydrocolators, pillows and pillowcases, hand towels, shoulder pulleys, McKenzie lumbar rolls, professional massage cream, foam rollers of varying sizes, resistance bands, fitness balls, self-adhering electrodes, digital TENS units, paraffin baths and paraffin bath testing thermometers, treadmills, vinyl dumbbell sets, medicine balls, mini bikes, leg press station, new step, upper body arm bike and recumbent bike, and a hand crank high-low mat platform table.
The following rehabilitation outcome measures may be used to clinically assess patients' functional limitations and impairments if appropriate. For dynamic balance and fall risk measures, the physical therapist and occupational therapist will be utilizing either the Berg Balance Scale, the Tinetti Performance-Oriented Mobility Assessment, the Timed Up and Go test, otherwise known as TUG, and the 4-Square Step test. For cardiovascular endurance, the rehabilitation department will be using the 6-minute walk test, 30-second chair stand test, 2-minute step test, and the Borg Rate of Perceived Exertion or Dyspnea scale. Outcome measures to measure gait include the Dynamic Gait Index, or DGI, Functional Gait Assessment, and the gait speed. And a couple of questionnaires that will be administered to patients include the Activity-Specific Balance Confidence Scale, or ABC scale, as well as a Coconut Cove Patient Satisfaction Survey given to all patients. For documentation purposes, all resident health information will be stored in the form of an electronic health record. Each employee who is involved in the care of the resident will have password-protected access to pertinent health information. Each specialty area, such as nursing, rehab, etc., will have its own set of computers, where login access is limited to those only who have special clearance or are directly involved in the resident's plan of care. Additionally, there will be laptops available in each area that therapists can take to different areas of the facility to improve accessibility to documentation. Each of these laptops are also password protected, and therapists are not permitted to leave the premises without securing the laptops in the rehabilitation offices, which is locked at the end of every day. Since all documentation needs to be completed electronically, all documentation for that day is expected to be completed before the end of the day. Employees will not be permitted to complete documentation outside of the facility. Minimum documentation required for all physical therapists involved in direct patient care include vital signs pre- and post-activity, including heart rate, blood pressure, and oxygen saturation, pain rating on a scale of 1 to 10, and documenting if nurse was notified of pain greater than 6 out of 10, accurate time in and time out of therapy session, and patient goals for therapy. Additionally, all documentation standards are required and expected to meet HIPAA compliance guidelines. It is the goal of Coconut Cove and its staff to create an open line of communication between staff members, management, residents, and family members. Each and every one of our residents should feel comfortable voicing their opinions when it comes to matters of quality of care, facility management, and other issues. In order to facilitate these open lines of communication, a monthly town hall meeting will be held with representatives from all disciplines present, including physical therapy, occupational therapy, speech therapy, nursing, housekeeping, and other facility management members. To improve patient outcomes weekly, meetings will be held between rehabilitation staff, such as PT, OT, and speech, director of nursing, and the family care specialist or social worker to discuss the progress of every patient who is currently receiving rehabilitation services. During these meetings, every staff member will have an opportunity to voice their opinion. A quarterly meeting will be held between the heads of all departments and the CEO of Coconut Cove to discuss facility issues, grievances, staff performance reviews, and any other issues that affect the quality of care and life of our residents. All residents retain the right to request a meeting with any and all staff members at any time. The time and place of these meetings will be at the discretion of Human Resources and the respective management team. At Coconut Cove, it is one of our highest priorities to manage risks, to minimize threats, and maximize our company's potential. Our risk management involves understanding, analyzing, and addressing risks to assure Coconut Cove achieves our mission and vision statements. As a skilled nursing facility, it is imperative that we determine the risks of all of our residents, including those with cognitive deficits and other complex medical conditions that have the potential to impact their ability to participate in activities of daily living and overall well-being. Our facility has determined objectives that all employees must follow to ensure the safety and well-being of all residents. These objectives include proper use of a gait belt during medical interventions and overall patient safety, employee training for natural disasters such as hurricanes, fire, and earthquakes, evaluation of pressure ulcers or any skin irritation, evaluation of falls, being competent to observe signs of elder abuse, education on medications and possible side effects, employee training for infection control, evaluation and employee training on all safety equipment in the facility, such as sharps containers, fire extinguishers, and weekly inspections of all medical equipment. As a therapist, there are certain protocols that must be followed to reduce any risks that may happen with a resident. The therapist must be educated on malpractice prevention, have defensible documentation, and know how to complete an incidents report for legal matters. Liability insurance will be provided for all employees. All PTs, PTAs, and rehab aides will meet with the rehab director once a year for an annual performance review. During this time, the director will discuss areas for improvement and any accomplishments the individual has made. They will also set goals for how they wish to improve patient care and dynamics within the multidisciplinary team for the next year. These goals will be reevaluated every 6 months at a follow-up visit with the director. Individuals will also be evaluated on their productivity, patient reviews, and willingness to work on holidays and weekends. Based on the individual's progress, pay raises and bonuses can be given as the director sees fit.